I agree very much that the focus on ends, and not just in terms of health outcomes, but also the health freedom, namely whether you have the freedom to go and seek medical help when you need it. You're not obliged to seek it, but you have the freedom to do it. And if you take freedom as the central concept of what capabilities you have, then you would like to look at how does the world work out, what happens in the world. And what happens in the world are exactly the things that you want to emphasize and judge. I would add to it the fact that the public discourse also sometimes misses out means in a big way. I mean, of course, here, as you know, the debate, the vilification of the European system, describing it as that no one has any choice of doctors, etc., was, of course, completely mistaken. But that is mistaken at a very simple level. But at a more sophisticated level, I think the American public discussion on healthcare has suffered far too much. I did try to write something in the New York Review on that, by concentrating on Canada rather than Europe. Because the big difference is that in Canada, you cannot have private insurance for other than some very limited purpose: dentistry, optometry, prescription medicine, and special room, private room. That's it. And whereas in Europe, you could buy an insurance, private insurance. Now, you may debate whether it is good that people with money could buy private insurance. There is something to be discussed. On the other hand, A, I don't think any system is going to be acceptable in America unless you allow that option. And B, there is an ethical issue. If a rich person is absolutely free to spend his or her money in buying a yacht and going to Acapulco and blowing the entire world with expenditure, why is it that a person can't buy an insurance which covers him for optional surgery and so on? So there is, bearing all that in mind, the natural thing would have been to look for a European alternative, which, and the debate seems to always miss it, which is not the case. It's single payer, but it doesn't exclude private insurance. Everyone has the right to go and have that insurance, which has that feature. And at the same time, you could buy private insurance. I mean, many of the universities and many of the employers do it. I have a private insurance, in fact, despite the fact that I'm also entitled to National Health Service. And there's no contradiction in that. There may be a general contradiction as to whether the rich should have a great advantage. You could have a debate on that. But I think this is just the kind of Smith territory. You may not agree on that, but you could agree on everyone being covered by a system like the National Health Service, which gives everyone the entitlement. Whether on top of that you allow, like in Britain, private insurance, or like in Canada, no such private insurance except for optometry and dentistry. That's a further debate. But we need not resolve that debate in order to outline the importance of having healthcare guaranteed for all the ends that you're referring to.